The stresses of the COVID-19 pandemic have harmed the mental as well as physical health of Boston's residents. Hello, I'm Russell Shute, professor of sociology at UMass Boston, clinical research scientist at Beth Israel Deaconess Medical Center, and co-principal investigator of the study Living in Boston During COVID-19. Our team includes researchers at Northeastern University's Boston Area Research Initiative, led by Dan O'Brien, and at UMass Boston Center for Survey Research, led by Lee Hargraves. The National Science Foundation funded our study to investigate the social impact of the pandemic across Boston's neighborhoods. Our previous reports examined exposure to infection risk and influences on risk behavior, economic impact, and willingness to be vaccinated. In this sixth public report, we focus on the pandemic's broader health impacts. Let's take a look at some of these findings. By the summer 2020, almost 1 in 10 Bostonians reported they had had COVID-19, and another quarter thought they might have had it. Just over 1/4 had been tested for COVID-19. By fall 2020, almost 1 in 5 reported their physical health had worsened, and more than 1/4 felt their mental health had gotten worse. Among our ongoing survey panelists, the percentage rating their overall health as very good or excellent declined by 7 points between fall 2018 and summer 2020, while the percentage feeling depressed and left out in the preceding week increased by about 20 points. Those rating their physical health more poorly were also more likely to report having suffered adverse physical and mental health effects of the pandemic. More drinkers reported adverse mental health effects of the pandemic than teetotalers. Fewer of the frequent exercisers reported adverse physical health effects of the pandemic compared to those who exercised little or none. Those who visited others more frequently reported less adverse effects of the pandemic on their mental health than those who rarely visited others. Let's look more closely at who reported worse mental health effects. Younger persons reported worsening mental health much more often than older persons. A higher proportion of whites and Asians reported their mental health had gotten worse during the pandemic compared to Black and Latinx respondents. Single women reported the greatest decline in mental health as a result of the pandemic. Married men and women reported about the same impact, while single men reported the least decline in mental health. Those with more education more often reported mental health as a result of the pandemic. 43% of those with a graduate degree compared to just 5% of those with a high school education or less. 4 in 10 of those working from home felt their mental health had gotten worse, as did 3 in 10 of those traveling to work, compared to just 1.5 in 10 of those who are not working. So, what have we learned about the changes in health during the pandemic? First, adverse effects, particularly on mental health, were widespread, and they were more likely to occur among those in poor health. Health-related behaviors like exercising and socializing and not drinking, and social circumstances like working from home and being single for women also predicted greater likelihood of adverse mental health effects. Surprisingly, more education and being employed, predictors of less economic harm from the pandemic, also predicted more reports of adverse effects on mental health. Preserving Boston's social health during the pandemic requires attention to the ways that altered social circumstances impact mental as well as physical health. Our survey clarifies the very different ways that various groups of Bostonians and different neighborhoods have been impacted by the pandemic. Efforts to help must take account of the trade-offs we have identified between reducing the risk of infection, lessening economic harm, and sustaining our mental and physical health.